Hello, everyone. I'm Wandana Khalili, Professor of Medicine, Director of the UCSF Research Coordinating Center's Investigator Development Unit for the NIMHD Health Excellence Action Network. I'd like to welcome you to our monthly training webinar. Today, we are honored to have Dr. Beth Terry speak to us on reducing the burden from multiple chronic diseases through innovative and integrated approaches to environmental risk reduction. Dr. Terry is a professor of epidemiology and environmental sciences at Columbia University. She also serves as the executive director of the Silent Spring Institute, a nonprofit research institute committed to discovery and translation of the role of environmental chemicals on cancer risk. For the past 25 years, she's led molecular epidemiologic studies focusing on the role of genomics, epigenomics, and other biomarkers in modifying the effects of environmental exposures on cancer risk and outcome. And she's led multiple multi-institutional studies focused on cancer health in New York City communities and serves as the contact PI for the International Breast Cancer Family Registry. Today, she's also joined by her colleague, Dr. Dodson, who is a research scientist and associate director of the research operations at the Silent Spring. During her presentation, please don't hesitate to ask questions through the chat function, and Dr. Terry and Dr. Dodson will be happy to address questions along the way and also at the end of the presentation. Dr. Terry, Dr. Dodson, welcome, and we look forward to your presentation.
Wonderful. Thank you so much, and thanks to all of you for joining today. I realize this will be recorded, so if you're listening to this after the fact, feel free to contact me. Either way, feel free to contact me always. These are my two emails, and I know this is specifically dedicated to young investigators, so please feel free to reach out to me anytime. In addition to my own research, which is in cancer epidemiology, I have for about 15 years run grant writing workshops and things like that at Columbia University. And so I'm always happy to work with new investigators with their aims and helping them flesh that out. So please do reach out. I'm also going to be joined for the second part of this talk with my colleague, Dr. Robin Dodson. And so the two of us will cover topics about how you can integrate environmental exposure assessment into studies of chronic diseases. So I'll start with kind of the big picture about why we want to do this, and also describe some of the work that we're already doing through the HEAN network. Great. So I sit as the contact PI for the Community Center. Community Center is a center to improve chronic disease outcomes through multi-level and multi-generational approaches, unifying novel interventions and training for healthy experiences. So it is a mouthful, but we use our acronym community. We also have a website for people who are interested in more about our site in particular. Please do reach out there or just email me directly. We are one of the 11 sites that have been funded through the National Institute on Minority Health and Health Disparities. And we have, similar to many of the other sites, we have 3 cores and we have 3 projects. So the cores are the Investigator Development Core, which is what many of you are affiliated with. We each have an administrative core and community engagement core. Our projects are focusing specifically on recruiting through churches in Harlem to reduce colorectal cancer incidence through improved outreach and connection to screening. Many of you may know, but the colorectal cancer screening guidelines have changed over the past couple years to now 45 and above. And so that's very important. And also this intervention trial focuses on reducing heart disease risk primarily through an intervention related to diet. So the intervention for this project is really diet and screening based. The second project that is part of our center is a sleep-based intervention. Again, this is addressing multiple chronic diseases of cancer risk as well as cardiovascular risk. And then finally, we have our third clinical trial is focused on breast cancer survivors and improving the way that medication compliance is done through an app-based technology that was developed. And this, again, would be for people who have multiple chronic diseases. So this is kind of how our center is structured. And across our region, we really have involved major hospital systems, including New York Presbyterian, of which Columbia and Cornell are part of. And we, within our community center, have one of the major centers is also at Cornell. We partner with Hunter, which is part of the City College, City University of New York. And we also partner with the Physician Affiliates of Greater New York, which is the research arm of all of the public hospitals. So this is our center in a nutshell. And why we are interested specifically on environmental exposures is because they specifically affect each and every one of these diseases. So you may be very well aware, but many environmental carcinogens are also obesogens. So they both can lead to more obesity, but also once you are overweight or obese, that is where a lot of environmental carcinogens can be stored. And so obviously incredibly important for thinking about reducing obesity efforts to go beyond individual kinds of interventions and much more thinking about upstream environmental factors is really important. Secondly, there's growing data suggesting that many different chemicals, including pesticides, including some of the legacy pesticides that we're still exposed to through water, dust, soil, affect hypertension. We also know, and some of this work is led at Silent Spring, which we'll say a little bit more about in a minute. We also know that some of these forever chemicals can increase hypertension. So, the heart disease model where hypertension is primarily driven by smoking and obesity and diet, those factors certainly matter. But more and more, there's large based studies that support how these chemicals also, independent of those other risk factors, affect hypertension. And particularly, we're seeing higher rates of hypertension in people who are exposed to certain environmental chemicals and who are not overweight. So for me, as an epidemiologist, that's the most compelling way you can address some of these questions related to chemicals and different chronic diseases. Is to show that those chemicals do impact on these chronic diseases in people who are not overweight. Also, diabetes, asthma, kidney diseases, depressive disorders, chronic obstructive pulmonary disease, and of course, cancers. There's well over a couple hundred carcinogens from environmental chemicals that the International Agency for Research on Cancer have already identified are group 1 carcinogens. So also, for many of you, if you have a strong interest in these chronic diseases, you know that they are the leading causes of death in the US, with heart disease remaining number 1. Cancer itself is number 2. However, when we look at one of the biggest drivers of health disparities, at least in many urban areas, and this is very true in New York City, the number 1 reason for premature mortality is cancer. So in the US, we define premature mortality as being under 65, dying under 65. And even, after the pandemic and other causes of death, cancer remains in New York City the number 1 reason for premature mortality. So it is a big driver of health disparities in our communities. If premature mortality itself affects families and communities and has many intergenerational effects on families and communities. So again, more of a rationale of why we need to look at these factors. So these are just some categories of broad categories of environmental exposures that have been looked at with these chronic diseases. Obviously, tobacco products, pesticides, volatile organic compounds, endocrine disrupting chemicals, metals, UV exposures, air pollutants. And it's important to note that uh, while some of these exposures have decreased over time because of regulatory action, some of the regulatory action is currently being challenged and may be reversed, but there are, even within cancer rates, very interesting patterns in that even though some of these environmental exposures are decreasing in overall at a population level with respect to things like air pollution, newer and younger birth cohorts, rather, they are exposed in a very different way than older birth cohorts. So if we're looking at some of the legacy pesticides, the younger birth cohorts can still be exposed to them uh, because they remain very persistent in our environment. But they're also exposed to hundreds and hundreds of chemicals, including hundreds of chemicals that are in plastic products that were not as common at all in previous cohorts. So when we're looking at what are some of the drivers of chronic diseases, in particular when we're thinking about the increased incidence in breast, thyroid, and colorectal cancer, among other early onset cancers, we're really looking at both different types of exposures, like with hundreds of common everyday plastic items and consumer products that we're being exposed to, as well as considering some of these other exposures that still have an impact on your cancer risks through what even your grandmother was exposed to. So again, thinking about these changing patterns is important, and why they're driving different, risk in different birth cohorts. So just to give you an example of sort of how pervasive these environmental chemical effects are, you probably have heard of forever chemicals or PFAS chemicals. They have now been clinically, there's clinical guidelines in areas that have heavy PFAS exposures to screen for kidney and testicular cancers. These are rarer cancers, but also thyroid cancer is something to look at if you've been highly exposed. These chemicals themselves, in addition to thinking about increase in hypertension, can increase lipid levels, as well as cause more common conditions that we're seeing in younger birth cohorts in particular, including ulcerative colitis, and have also a very big impact on response to infection. And this was, shown over COVID, as well as decrease vaccine responses in general, impaired neurodevelopment, and as well affecting pregnancy outcomes, both in the mom and the fetus. So these are very important, persistent and prevalent chemicals to think about. So within the community center, we have do a lot of work in the city. So the five boroughs of New York are down below. But also we work with state legislators through our environmental working committee for policy reasons. And New York is very, unfortunately, it's similar in many other states when we look at really the overlay of where we're seeing higher chronic diseases and cancer in particular, and where pollution sources and brownfields are. So again, these communities, what you're seeing here is a mapping by the state of environmental justice communities. And what you can see here is one, just how prevalent they are across the city and state, but also to think about that just in terms of the other predictors of these chronic diseases and the demographics that make up these environmental justice communities. So again, important aspect to thinking about beyond individual risk factors, but to think about the upstream environmental effects on all of these different chronic diseases. So one resource that you may want to use depending on what state you live in is a website called saferstates.org. This website itself can give you much more detailed information about what policies have been introduced and what you can do as a researcher and community member to engage in policy level solutions for mitigating a lot of these environmental chemical exposures. So I want to just spend just a few minutes, and then I'm going to introduce my colleague on what we're doing right now within the Health Excellence Action Network. So two of my colleagues, I think Nicole may be on now, Nicole Bain and Dr. Soko Setaguchi, the three of us run what's called the ECO working group, the action group. And ECO stands for Environmental, Chemical, and Contextual Characteristics. If you're not part of this working group, but you'd like to be, please do sign up. And so you can do that by either emailing me and or the coordinating center, and they'll get information to you about this working group. What our objectives are within the HEAN network is first, what we did was complete a scan of existing projects and pilots that were environmentally focused. Then we have been reviewing the literature on whether other kinds of interventions exist that have been related to environmental exposures, what kind of clinical trials are currently going on. And then we've been developing scientific initiatives for the HEAN network. And one of the things that we're working on that we'll present next month at the national meeting is taking some of the work from the existing interventions at the different centers and where we can add an environmental component and or starting new kinds of interventions across across the country through the HEAN network doing direct environmental risk reduction. So again, I would love your participation, and please do reach out if you want to be part of this working group. And so one of the things that we've been talking about too within our network, and because Dr. Setaguchi is part of the HEAN site at Rutgers and NYU, is that regionally there's differences between New York state policy and New Jersey state policy. And so we're hoping to compare kind of outcomes that exist within more of a narrow area geographically, where some of the individuals have the same access to the same hospitals, but they have very different policies at the state level when it comes to thinking about some of the interventions. I'll say a little bit something more about that in a minute. So broadly, here are the different centers within the HEAN network that have already within their interventions an environmental component. So Achieve Greater has been measuring PM 2.5 levels. A lot of environmental exposure data can come through linkages and using some of the EPA data, as long as you have residential address history or other kinds of information about where the person lives, works, or plays. And also what they're doing, and they have a large extension study now that's a randomized clinical trial looking at some of the home exposures to PM 2.5 using an air filter, randomizing people with heart failure and using an air filter to measure whether or not having a home air filter improves patient outcomes. Keep in mind, we spend sometimes, depending on our age, but we spend whatever our age is, we spend more time inside our house than we do outside our house. But especially elderly people and people with chronic conditions are likely to spend more time, much more time inside the house, as much as 90% inside the house. So these kinds of home interventions may be, really impactful in thinking about reducing indoor air exposure. And we also, across different studies, so CAPP also has been looking at just through questionnaire design and others, just thinking about the sleeping environment, home safety, physical activity opportunities. If anyone's interested in some of the questionnaire measures that we use across these studies, we can certainly talk to you about that. If you're planning to do a pilot study with any data linkage to environmental exposures, we can certainly talk to you about that. At our own site, we're looking at a sleep intervention, and we have a supplemental project run by one of the MPIs, Dr. Erica Phillips, who's looking at a home air filter. We also there's across Heen also looking at tobacco exposure, both obviously indoor exposure to passive smoke is a very large exposure to environmental exposures within the house. So looking at some of those interventions. So very briefly, I'll just tell you an intervention we have ongoing right now that we're doing within Washington Heights area of New York City. And we are looking at an air filter intervention. This is a pilot study looking at multiple ages within a household. I think Andrea Reyes, who's worked on the first phase of this study, is on the line, and she can address any questions you may have. And again, what we were interested in, because our center focuses on multi-generational risk reduction, we were interested in specifically looking at households that had a young child and an adult to participate in this. So what this is basically we have an air filter intervention as well as cleaning supplies that are given to one household, and then the other household will get it at the end of the study, and we're measuring environmental exposures in the urine, as well as then looking at pre-post changes over time. This is in collaboration with We Act for Environmental Justice and also Silent Spring Institute. This just is a quick summary of where we're at right now. This was not funded through the Heen network, but received supplemental internal pilot to do this. And we are measuring blood pressure as well now in the second phase of this, as well as indoor air monitoring. And then we more broadly, both within Heen and also through networks that have been established through Heen, we're doing two proposals now, one working within our cancer clinics to reduce environmental exposures in cancer patients and their relatives. We call this cascade prevention, just like you think about cascade genetics. So any family member will be at higher risk of cancer, either from shared genetics and or shared environment, often a little bit of both. And so we have this interventions that we're starting related to how, measuring environmental exposures, but then also looking at how to reduce them through report back. And then we also are planning, and this is a grant that my colleague, Dr. Robin Dotson, will be leading. And this is also established through our Heen collaborations because it involves collaboration with the City University of New York and specifically the City Medical College, so CCNY, and Dr. Elizabeth Cohn, who I think many people know as part of this network. So I think that's where I'm going to pass it to my colleague, Dr. Dotson. Robin, are you on? There you are. Okay, good. I didn't see you before, but I see you now. So Dr. Dotson is, so I now split my time between Columbia and Silent Spring. I've been had the great fortune of serving as the executive director now for Silent Spring for the past 18 months. And Dr. Dotson is one of our amazing exposure scientists. And so she's going to walk you through the rest of this talk and specifically talk about work that she's led over 10 years now, probably a little longer, right, Robin? But looking at housing interventions. And she and her work has been highlighted by HUD And HUD specifically contracted with her to design some of these digital tools. So she's going to walk you through those. Hopefully, I've convinced you that you want to measure environment and intervene on environment. And that, especially when we're thinking about chronic disease, it's not just about your diet and your individual weight, but that many of these upstream environmental exposures are really important, and that we should be thinking about how to integrate them for the next round of intervention work. So thank you, Dr. Dotson, for joining today.
Awesome. Thank you, Mary Beth. I'm really excited to talk with you all and kind of share some of the tools that we have. I will say, just another plug for Dr. Terry saying that you should be thinking about environmental exposures. In fact, there's a whole field of environmental exposure science, people like me who would love to collaborate on some projects. So please reach out and we'd love to collaborate. So I'm going to tell you a little bit about some of our digital tools that we've created at Silent Spring. We see digital tools as really a way to not only enhance some of our communication with study participants and generally consumers, but also as a way to collect information and do research projects. So I'll go through a couple of those, including our some of our new tools that we're just developing now. So you can advance, Mary Beth. So I'm going to start off by talking about our Detox Me. So this is an app that we developed now almost 10 years ago, where we aggregated research findings. Every single time we would do a research study, we would create these kind of fact sheets or kind of top tips, and realized that it was kind of clumsy to walk around with a whole bunch of sheets of paper with a bunch of fact sheets. So instead pulled them all together into an app where we have nearly 300 research-backed tips based on our research and research of others to try to lower exposures in our everyday lives. It is widely available. It is available in English and Spanish. It's free. It's on your app phone. It's on your Android phone. And there's also a web-based version for folks who do not want to use the smartphone app. But what's really great is that this could be used for supporting intervention studies. And in fact, we have put it into some intervention studies to try to support our participants. Because it does allow kind of free exploration of these different tips or different strategies for reducing exposures inside the home. So check it out. That QR code should take you directly to our website to where you can learn more about it. So building on that success with Detox Me, we have recently been developing a healthy home app. And this healthy home app is kind of taking this kind of the same approach of thinking about evidence-based recommendations for reducing exposures inside the house, and really bringing it into the home and developing it in a way that is really approachable for users. So it is meant to help support what we call a home walkthrough. So this might be a typical thing that you would do with, say, an environmental health professional walking through their home, trying to identify different housing hazards that need to be addressed. And so this app is supposed to put that right into your hand. In fact, we are right now developing it and going to be testing it with some HUD funding so that we can use it in home visiting programs, so early intervention studies or programs or other programs that might be using community health workers to go into homes for early childhood development reasons, could be using this app during their home visits to share this information. And the reason we made this app is because EPA, actually through their PACEs, were getting a lot of questions about wanting some tools or resources for supporting kind of healthy home interventions. And so they actually reached out to us after seeing Detox Me and said, hey, what about making this for homes? And so this here is our attempt at that. So we are creating this now and testing it. It is, we originally designed it to just focus on lead and asthma, but it's now much more expansive, covering a lot of chemical exposures inside the home, including pesticides, flame retardants, phthalates, PFAS, allergens, you name it. So this is being tested right now and will be available, but we would love to kind of talk about any potential research collaborations because we're very open to this. Yes, thank you for defining what HUD is. Another part of the app that we are developing is to build out what we call the Detox Me Logger. This is an app that we're developing to collect very detailed or highly detailed information about products that people are using. It can be personal care, cleaning products. And the idea here is that it collects information about how people are using the products, as well as information about what ingredients specifically are listed on the product. This is coming out of a research study that we I've been in part of for several years now, called the Taking Stock Study, but in where we are trying to collect very detailed information about product use. And the importance of doing this is because, yes, there are other product apps out there. This is different. This is different because what we do is trying to generate a more holistic approach to thinking about what people are using and trying to help people identify or prioritize certain products for replacement. Instead of just one product at a time. And this can be really important for an intervention study where you cannot support a kind of a whole swap out of people's products, but rather you could think about and target maybe the most worrisome or the most risky products based on the ingredients to be swapped out. So that we anticipate actually to be available in the upcoming months. Another tool that I'm not as intimately focused on, but Mary Beth actually brought this up, is a lot of our work is centered at Silent Spring on PFAS, so forever chemicals. And so as part of that, the PFAS team has developed what's called the PFAS Exchange, which is a great resource or hub for people to learn more about PFAS, including has clinical guidelines and things like that. But one key part of that is what's called the What's My Exposure tool part of the PFAS Exchange. And it allows people to understand or help interpret their blood and urine test results, where they can actually enter in their own test results and learn a little bit more. It gets a personalized report based on some of our previous work on Report Back and provide some personalized information about health effects and tips for reducing exposure. So again, another resource for folks who might be studying PFAS in their studies. And of course, our Derby, which we call the Digital Exposure Report Back Interface. Katie Burno, who's on this, who leads a lot of this work, is on the call as well. The Derby reports is really building out a lot of our research that we've been conducting over now decades on looking at effective and ethical ways to share study results with study participants. And this is a software interface to help people generate reports for their studies. So this can be seen as both a way to increase community engagement, a way to support community-based research, a way just ethically to really kind of incorporate your study participants into your study by reporting out at the end. It can also be an intervention tool in that it can be used as a way to look at kind of increases in awareness or knowledge and behaviors around exposures. So for example, it's been tested to show that increases actually environmental health literacy or motivation to act based on people getting their report. So it can be used both as a research tool as part of an intervention, as well as a way to just share study results with participants, regardless of the study type. These tools, these reports rather, have some really key features that have been developed after years of research. So all of these reports include what we call a summary page, which give these headlines, these personalized headlines, depending on their results. This is really important because it distills down some really important information for participants, and they see it right away. What's really great about doing this in a digital space is that it allows for a layered design, or people are able to navigate this to the extent to which they'd like to. And it also includes graphs and comparisons to both benchmarks when they're available, as well as others in the study, and really allows people to engage with their research results in different ways. So here you can see an example of the graphs where we show where where their individual results are relative to everybody else in the study. And sometimes if there are available benchmarks like biomonitoring data that we can compare to. So, part of why I'm here is because we are open to collaboration, and we would love to learn more about your projects and thinking and brainstorming together on some studies. We have not only at our disposal a lot of these digital tools that I've just gone through, but also a lot of expertise in exposure assessment or exposure science, whether it be, collecting urine samples, collecting wristbands, collecting indoor air samples, all of that, so that we can kind of more holistically give more personalized exposure feedback and guidance to your study participants. So check us out at our website. Oh, Mary Beth, you're muted.
We wanted to allow time for questions to see if people had, thank you so much, Robin, to see if people had questions about their study design and/or other ways to think about integrating this within your current interventions. So keep in mind that, a lot of things that are looked at in the diet also very much interact with environmental factors. I mean, not just with respect to pesticide exposures, but certainly that's one prime example. But there was work by some of our colleagues a few years ago, just looking at the level of PFAS exposures in wrapping fast food chains and the wrapping around a burger. So I know a lot of different sites within the HEAN network are doing dietary interventions. So just keeping in mind that it is important to think about multiple sources of exposures and which ones are more readily modified. And again, to think this individual risk reduction and the family level within a household is also important for driving community action. So I don't know, it looks like maybe Liz is not on, but Robin, if you wanted to say something specifically about, I know the new intervention you guys are planning in New York City housing, it's an individual household intervention, but the point of the intervention is for policy within the housing system. So I don't know if you want to say anything about that, Robin, or.
Yeah, no, just that, I think a lot of these, I'm really excited because I've done a lot of other housing intervention studies, but doing it within the largest NYCHA housing, right? It's the largest urban housing development program in the United States. So excited to think about how these studies could be done in a system like that, because it really could influence how those developments are managed and go beyond that, of course, into New York City and to other places. So, and what's also really exciting about that is that it's family level. So we're going to be engaging both children as well as a caregiver in the house, which is really exciting from an educational perspective, as well as just kind of understanding exposures.
Great. So are there questions or suggestions? I see a couple people from our ECO. Dorian, did you want to say anything, or Stuart, or some suggestions you have in terms of measuring environmental exposures? I know you know a lot about data linkages.
Yeah, actually I had a different question. So I just downloaded that app and the Detox Me app. And wondering if you can share if you have the information from your data so far, what tend to be the items that make the biggest impact for people making changes, for example, cleaning products or something else. And then also what people might find the most surprising in terms of, if people are already buying natural products, but natural doesn't necessarily mean healthy because, arsenic and strychnine are natural.
Mm-hmm.
Uh, so, I wonder if you can have any of any of that information to share today.
Yeah, no, that's a really good question. Not off the top of my head. I mean, we have the app analytics generally about how people are engaging. I haven't looked at that data recently at all. I will say that we are finding that some of that guidance we can see kind of trickling down and working. So, for example, we did a crowdsourced biomonitoring project that was basically, we called it the Detox Me Action Kit. It was built off using Detox Me. So the idea is that people would use Detox Me thinking about how they could try to reduce their exposures, and then take part in a crowdsourced biomonitoring study where we collected urine samples from 750 people across the country. What's interesting is that we were able to find some of the recommendations in this app are to read your product label and to what specifically to look for in your product label. And in fact, we did see that people who read their product labels tried to avoid chemicals like parabens, some UV filters, triclosan, which is a preservative, and antimicrobial. All of them, people who did that could actually reduce significantly their exposure to those chemicals. So that's really great. It's kind of demonstrating one of these kind of things that consumer can have a significant impact on their exposures. But yeah, no, it'd be good to look. We've looked kind of generally in some, but I think it's so case specific, generally some studies of where people have been using the app. So I'm not sure it's generalizable necessarily, but we could look. We have that data, and that data would be available to anybody who used the app for an intervention study.
And Katie, I don't know if you wanted to add anything or.
Yeah, I was just going to mention, not in the context of using the app, but in the context of report back, we do measure what changes people make after getting their report, which includes a lot of tips that are also in the app. And so we do see like many people will do things like read their product labels and make swap out things in their personal care products. We've had less success with like changing people's habits and like getting people to like vacuum and dust more often. That's been harder, but like very kind of like one-time actions of like, I'm going to swap plastic for glass. Like people do have a lot of uptake on that.
Thank you so much, Dr. Terry, Dr. Dotson, everyone for an outstanding presentation, recognizing that it's such an important field. Thank you for putting it within a context of chronic diseases and its relationship to that, providing us with tools that could definitely be utilized in thinking through what kind of opportunities exist as we move forward. I have a specific question for you, Dr. Terry, in thinking about sort of career development and the cohort that is attending the talk today. In thinking about our early stage investigators trying to either pivot or integrate an environmental component within their research programs, and recognizing that there's many information out there and specific tools that could be utilized. You mentioned ECHO as a resource for the HEAN members, but is there any particular recommendations you have as to how to start the process, think about capturing pilot data, for example, and then moving forward with submission of grants and applications for funding in this area?
Sure, yeah. So I think, well, one, I personally have never been more excited about the possibility of integrating some of like what community members have always told us to measure, but was really hard to measure before. One, because there is a lot more ability of large databases that can be linked to where you live. And so that's one area that can be done. And now, like, whereas when I was a doctoral student, we did measure a few environmental chemicals on Long Island, but just measuring one chemical at a time outside of an occupational setting is quite difficult then for both for the expense of the study, the feasibility of the study, but then the interpretation. Whereas now, and we didn't talk about it today, Dr. Dotson had the last slide alluded to it, but we're working with collaborators at Yale, but there's wristband technology where you can measure hundreds of chemicals at the same time. And I do think it's really important to recognize that, all of the knowledge that we've gotten from epidemiology for heart disease and for cancers and for other chronic conditions, they only continue to explain a small percent or a percentage of what's going on with chronic disease. And so, we do know that, again, many of these chemicals increase your blood pressure and hypertension specifically in people that are not overweight and, may or may not have a good diet. I don't know, but at least that point of it, we need to stop the model of chronic disease where it's all about the individual. So, a lot of this is both to try to increase environmental health literacy, as well as to increase the way that communities can have action, but also healthcare providers can be informed about what to look at and how to order a PFAS test if someone's from a heavily contaminated area, for example. But I'm very energized by younger people because younger people want to look at this. They have the fresh ideas to look at some of this. And I do feel like now the tools are really, really getting very, well, they've always been good, but now it's feasible to integrate these tools within a study. So and like I said, for the people who are part of the IDC and any of the young people, I'm happy to help in any way, like work on aims and think through this. And please do join the ECHO group and we can think collaboratively about this.
Thank you very much. We have a question from Dr. Shu, who is asking for the indoor air monitoring filtering system. They can be expensive, and for people who potentially have low socioeconomic status, this may or may not be sustainable. Do you have any sustainable resources available to those communities?
And I'm asking,
sorry, go ahead. And would you mind introducing yourself as well as to which area you're from?
Of course, Ping-Ching Xu from Arkansas Rural Community Health Study in University of Arkansas for Medical Sciences. And when we visited rural communities, we see a lot of the communities, they're still drinking well water, and they also have really old, crappy house with molds, and they really cannot afford moving out. So we are almost certain to know that they will have significant difference in their indoor air quality or exposure. But what do we do after showing or after seeing the significant data or after testing and seeing the difference? How should we I'm just wondering if there are any other program. I know HRSA grant will support like memo van or lung van for screening. Any other resources that we can identify to support funding, for example, to expand city water to rural communities or to support like air filtering system in home? I'm just trying to think about a way that could actually help the community rather than showing the data.
Yeah. A lot of questions within the question, but a very important set of questions. I'll just quickly say one thing about why state policies are really important, and then I'm going to pass it to Robin because Robin has been doing a lot of low cost interventions in the household. But from a state point of view, this is where, and we can send around the slides or whatever, but if you didn't catch the URL for the state information about what's in your state and what you can do. I know New York State actually has a program now that you can get an air filter for free, but a doctor has to prescribe it. So a doctor can prescribe it if you have a chronic condition, but they can't yet prescribe it preventively, if that makes sense. But so state policies do really matter. Robin, do you want to talk about the Corsi Rosenthal boxes or?
Yeah, so there's a couple of things, a couple of thoughts, because we've been thinking a lot about what's kind of accessible to people. And so, for example, we looked at installing those Corsi Rosenthal boxes, which are those it's the DIY air filters that people were making during COVID. So it's just a couple, it's everything you can buy at a hardware store. So it's a couple of furnace filters with a box fan on top. So you can make that for less than $100. And it actually, we showed that not only was it mitigating COVID exposures, but it was actually significantly reducing levels of phthalates and PFAS in indoor air, and likely more. We just happen to look for phthalates and PFAS. So I think also what I think that speaks to is this idea is that there's a lot of co-benefits that may not be totally realized here, and thinking about some strategies may be more effective for multiple different environmental exposures at once. So air filtration in particular, I think is really, really important. And I think there are some programs that are trying to get those into people's homes, and which I think is highly effective. The other thing that we have seen in particular is, well, Katie said the uptake on cleaning is can be difficult, but what we did in one study in Rochester, New York, which was with a lower income, it's not rural, but it's a lower income community, that providing kind of simple cleaning supplies, things like just, like Castile soap and sponges and a bucket and things like that, and teaching them about in that case we were really interested in lead safe cleaning. So highly effective. That entire cleaning, we put it all into a bucket and handed it to the participant, and that was all less than, it was like $25, and shown to be kind of highly effective, which is really great because a lot of these chemicals that I think a lot about in the indoor environment make their way, they're not only found in air, but they're found in dust, and that's particularly a concern with children. So anything that we can do to try to reduce levels of dust will reduce our exposure to chemicals that like to hang out in dust. So the other thing that we did is that we were able to get some grant money. It was a local foundation, so but they seemed quite excited about the idea of we were able to buy like lower cost but still effective HEPA vacuum cleaners for participants. Most of the people, it's something like 95% of the participants in our study did not have a good high quality vacuum cleaner. And we were able to provide that, and they were using it. And it was showing to reduce levels of allergens amongst other things in the dust. So, again, fairly low cost, but maybe there are creative ways to kind of get support for buying air filters or buying HEPA vacuum cleaners to get into people's homes.
Thank you. And your software or apps are very helpful. We'll try to reach out to you. But can I ask one more question? Have you tried or tested the water filter systems? Are they effective or integrated in part of your app?
Yeah, no, so there is some information about water filtration in there. Also, the great place to learn, to learn more about water filtration is actually our PFAS Exchange, which is that website I highlighted, but also you can find it on Silent Spring's website. It actually gives some very detailed information about what kinds of water filters are most effective, for different kinds of PFAS and generally. So I checked that section of our website.
Thank you so much.
Rochelle, I love that you call that whole paychecks. That's what my brother-in-law started using that name a few years ago too. Other questions or comments?
Yeah, so I have a question. It's more maybe an observation. So when we were having wildfires in San Francisco, I at that time only had one air filter in my house, and I was moving it from room to room from whatever room that I was in. And because of that, I noticed, and it has an indicator light with sort of 5 different levels of air quality. And I noticed that when I turn on my gas stove, the air quality went really bad, really fast. And so in terms of burned natural gas residue exposure and respiratory health, to what extent do people know about it? I know there have been movements in certain communities to ban natural gas stoves and move to induction stoves and other kinds of systems, and to some extent that's been stopped or reduced under the current administration and certain legal challenges. But is that something that you also measure, or something that you make people aware of in terms of natural gas exposure?
Yeah, that's a great question. I mean, the what we're most concerned about with natural gas stoves is NO2, so which is a potent asthmagen, and so that we at Silent Spring don't tend to measure that, but what we have been doing is actually been doing a study where we're looking at PM 2.5 concentrations in people's homes, and it's an intervention to try to understand what level of education people need to take action. So it's like we have this like one arm that's just passive education, and where we're just monitoring and they don't know the results, and then we have an arm where they get a lot more education, including the fact that they can see their PM levels and the indicator lights, whether or not it gets, from green to red or something like that. So, and that actually we can see that people, when they're able to see their air quality and they're given some education about how to interpret that and what that means to their health, that they actually, the result is that they have significantly lower levels of PM 2.5 overall, which is great, right? So it's this idea of people kind of like getting to hands-on experience and then learning, how to interpret it for health has been shown to be effective. So so we were looking at that more on kind of the educational kind of side, but that it's great news. Yeah.
And I want to just give a shout out to to all the work that Katie's done over the years with her colleagues too, because especially sometimes the first reaction, like from a clinician, might be like, this increases anxiety in my patients. I don't want to talk about the environment. But Katie has done a lot of research that shows quite the opposite, that it actually reduces anxiety and certainly doesn't increase anxiety to share these results, and people feel more empowered when they have them, and certainly the community has always been asking for them. Great.
Okay.
So feel free to email us and join ECHO if you can, and thank you.
Thank you so much, Dr. Terry and Dr. Dotson. Really appreciate the presentation, and we look forward to seeing you at the HEAN conference. Thank you again.
Great. Thank you.